I will be talking to you today about Medicare. Such a thrilling topic, I know. However, the biggest thing here is that it's very nerve-wracking for people when they have to make that transition. And so hopefully by participating today, you will feel a little better about the topic. You'll feel like you can explain a little bit or have some comprehension of what your options are, how much Medicare will cost, and your timeline. I get asked a lot, when do I start taking steps? What can I do? What can't I do? What are the penalties? We will cover all of that today. I will stop periodically and double check the chat to make sure if anyone has questions that I address them. Feel free to put them in the chat bar if you would like. I do know there's also a Q&A window as well, and I will check on that. Okay? All right. With that, we will get started on what Medicare looks like for you. So Medicare is a federal health insurance program. It is available to anyone turning age 65. It is also available to people with certain disabilities, okay? So if someone has end-stage renal disease, they will end up qualifying for Medicare. If someone is receiving Social Security disability and they've received a check for 24 months, they also automatically become eligible for Medicare, okay? So just remember, it is a social insurance program available to you at 65. And so that will be our big focus today. Of course, some of the basics apply to Medicare eligibility at any age, okay? Now, I do like to first make sure I mention to people, what is the difference between Medicare and Medicaid? I have a lot of people that will call me and yes, I become Medicaid eligible next month. I turn 65. And in reality, they're becoming Medicare eligible. Medicare is the insurance program. It's not income or asset based in order to qualify. Now, there are some areas where income could affect what you're paying if you have a higher income, but you don't qualify because of income. Medicaid, you qualify for because of income issues. If you lack resources and income, you could qualify for Medicaid. The state would make that determination after reviewing information that you provide and that they obtain from the IRS, okay? So we will focus today on Medicare. By the way, it is possible for some people to be Medicare and Medicaid eligible as well, okay? So keep that in mind. Now, moving forward, I want to talk about just the basic parts of Medicare, what you would pay for Part A and B and C and D. Those are what we would call parts of Medicare, and we'll cover the payment here in a minute. Part A is hospital. Part B is your medical insurance, so your doctors and outpatient services, okay? And your Part C would be Medicare Advantage plans and Part D drug plans. A and B have been around for over 60 years. C and D were introduced in 2006 to give people additional options on top of their A and B, okay? So if you are 65, you no longer have employer coverage, or maybe you're waiting until 67 and retiring and losing it, no matter what, you will have to pick up A and B original Medicare in order to have any other coverage. Now, Part A, hospital coverage, this is where you will still have some costs for your stay in the hospital. However, your premium is $0 as long as you have worked and paid FICA taxes for 10 years, or if you were married to someone who was paying those taxes for 10 years, okay? The premium is $0 for most people. Now, if you go to the hospital, the cost is not $0. You are going to be paying some cost for the hospitalization. Under Part A, you pay the first $1,632 for a hospital stay. And then Day 61, so that would be for a stay anywhere from 0 to 60 days. But day 61, you begin a copay per day cost of $408 a day. Day 91, your copay per day becomes $816 a day. Okay? So you have the first $1,632 that you would pay if you're admitted, whether it's one night or 60 nights. And then you go to copays per day once you hit day 61. Okay. Now let's say you're in the hospital for 3 nights, you pay the $1,632, you go home, you go back within the 60 days of the first day you had been there, you don't pay that deductible again. However, if you go back 4 months later, you will pay the $1,632 all over again. Okay. Now, the days 91 to 150, I do want you to know those are considered lifetime reserve days. What that means is if you were to have a hospital stay of 100 days, you use 10 of those reserve days and still have 50 days beyond day 90 that you would have coverage options. Okay. So days 91 through 150, you only get one time in your life. That would have to be a consecutive stay in the hospital. Part A does also cover hospice care, and they cover it very, very well. They cover blood as far as transfusions, and then they cover some skilled nursing care. You do have to have been in the hospital for 3 nights admitted and go directly to a skilled nursing facility. At that point, Medicare will potentially pay for 100 days. Days 1 through 20 have a cost of $0 to you. Days 21 through 100, you will pay $203 a day. Okay? So what you do need to know about the chronic long-term care in a skilled nursing facility is that that is not covered by any part of Medicare. Okay? So you could still get doctor's appointments or rehab covered, but your room and board is essentially not covered for. Okay? So keep in mind, these are your costs still under Part A. I'll be referencing those numbers as we talk through this presentation. Now, Part B, which is your medical insurance, where your doctors and outpatient services are covered, you will have an annual deductible of $240. So you may not pay that all at once. It would work similar to a deductible you would have on your health insurance now. Let's say you go for labs, the cost is $50, you pay that, and that gets counted towards your $240. Okay? If you have an MRI as your first claim on Medicare, you're likely to meet that $240 in one fell swoop. Okay? Now, after you pay the first $240, Medicare then begins paying 80%, and you would be responsible for paying 20% of the bill. Do keep in mind, once you're on Medicare, you would be working off of Medicare negotiated rates, okay, which they're usually much lower than like your group plan rates that you see now. Part B medical insurance is one area that you will pay a premium. So the base premium is $174.70 a month. So majority of the people pay that premium, okay? If you have higher income, you could pay what's called an IRMA, IRMAA. So that stands for Income Related Monthly Adjustment Amount. You can get the full chart on Medicare.gov or socialsecurity.gov. Essentially what you need to know is they will be looking back 2 years on your income. So they don't look back at the last 2 years, they look back at your tax return 2 years ago. If you're enrolling in 2024, then they will look at your 2022 modified adjusted gross income. If you were an individual tax filer, if it's above $103,000, or if you are a joint tax filer and your income was above $206,000, you will pay more for your Medicare Part B premium, okay? So just keep that in mind. So base premium $174.70. For most people, that's what you're paying unless you would have Medicaid benefits as well, okay? Now, Part B does not have an a maximum out-of-pocket limit. So you continue to pay the 20% ongoing. Okay, there won't be a limit. Just like under the Medicare Part A with the hospital, you could continue hospital costs up to an infinite number. Okay. Now, I do want to go back to one of the penalties that can occur that people worry about, and that's the Part B penalty. Part B has a penalty of 10% of the premium, so 10% of the $174.70 that you would pay for every 12-month period that you didn't have Part B and should have. So let's say you've retired. You retired at 62, you turn 65, and you say, I don't want to pay for Part B. I'm not going to take it. You drop it. You only have Part A, which is 0 as long as you work 10 years. And what would happen is later on, if you want to pick up Part B, number one, you can't just pick it up whenever you want. You have to pick it up between January and March, and it would not start until July, and you would pay a 10% penalty for your lifetime on top of whatever the Part B premium is that year, okay? Now, what you should know is if you are still working and you have employer coverage and you become Medicare eligible, that employer coverage will prevent the Part B premium, okay? If you are working and have employer coverage, you do not have to pick up A and B Medicare. Now, we're going to talk on a future side about the size of an employer you work for and if that could mean that you should pick up A and B. So don't take that as a blanket statement. Just know, in general, most people do not need to pick up A and B if they still have employer coverage, okay? We'll talk about why that may or may not be later, okay? So just know these are the benefits that you have under A and B, hospital and medical, and you would still have some costs that you incur, okay? They're not going to cover 100% of all of your medical costs. Now, Part C is Advantage plans, okay? So Advantage plans are operated by private insurance companies. You still have to enroll in A and B, and essentially the government takes the $174.70 and doles it out to the private insurance company, and your claims go through the private insurance company instead of original Medicare, okay? Now, they will pay for your benefits. The claims will be filed through the Advantage plan carrier, okay? Most do incorporate drug coverage into them. You need to not only see a doctor that takes Medicare, but see a doctor within their network in order to save yourself the most money. These plans will change every year. So maybe the copays change, maybe your premium changes, your hospital copay per day, that type of thing will change. They replace the schedule under A and B that we went over on the last screen, on the last slide, and they set their own schedule of benefits. The government does mandate that they cover what original Medicare A and B pay, but not your portion. So that $1,632 under Part A, we'll just reschedule how that gets paid, okay? So just keep that in mind. They do have to have an out-of-pocket maximum. So if you move to a Medicare Advantage plan for your benefits, then they will have to have a maximum out-of-pocket you could be responsible for, okay? Advantage plans can be changed every year during the annual enrollment period. Okay, so every fall you have the opportunity to switch to a new Advantage plan. Okay, if you're happy with your plan, there's nothing you have to do. It will roll over into the new year. Your A and B always rolls over into the new year. Okay, we'll touch base on these again here in a little bit as well. Part D, that is where your prescription drug coverage comes into play. As I mentioned before, Advantage plans, most of them wrap the drug coverage into the Advantage plan. This is referring to standalone prescription drug plans. So if you're just covering your prescriptions, these will also change every year. There is an annual enrollment period to make a change to your plan. So maybe you have new medications, maybe you want to use a different pharmacy. Maybe you like your pharmacy, but your plan is no longer going to cover it in the new calendar year. You could change your plan from October 15th through December 7th, and it will begin on January 1. Now, the other penalty that can occur under Medicare is under Part D. Now, that penalty is 1% of the national average cost of a drug plan. Currently, the average cost is $34.50, so 0.345, and they take that times the number of months that you went without creditable drug coverage since you were age 65, okay? So if you were 65 and you had moved, you had your A and B, maybe you picked up a Medicare supplement or something, but you never picked up drug coverage because you thought, I don't take medicines, I don't want to pay for a plan. Later on, you would face a penalty when you go to enroll in a drug plan, okay? That penalty is paid every month for the remainder of your life, okay? What I can tell you is this: there are some very inexpensive drug plans out there. You are better off picking up a drug plan once you turn 65 or leave employer coverage, okay? Because that way you will avoid having that penalty in the future, okay? So just keep in mind the two penalties are under Part B and Part D. If you still have employer coverage, you are going to avoid those penalties. If you have individual health coverage through the marketplace, if you have a Medicare Christian share plan, you have a short-term health plan, you could end up facing those penalties, okay? When you're 65, you need to move to Medicare. The only exception would potentially be employer coverage, okay? I'm going to make sure I pause here just a moment. I've been checking the chat window here. Don't be shy. If you do have any questions, feel free to type those in there, okay? So far we've covered original Medicare A and B. We've talked about Parts C and D that came out in 2006, okay? And now we are going to focus on when can you sign up for Medicare, okay? So you have a window of time that you can sign up so you're not worrying about a penalty. Medicare is all about enrollment periods. You can't just suddenly decide to enroll in most of these plans, okay? Or in original Medicare A and B. When you turn 65, you have an initial enrollment period they refer to as your IEP. This is a 7-month window, okay? So I'm going to use an example saying that a person has a birthday of September 15th, okay? So September would be this E, which is the first month of eligibility. What you need to know is Medicare begins the first of the month that you turn 65. And if you are lucky enough to have your birthday on the first day of the month, you actually receive your Medicare 1 month earlier, okay? So in this example, I'm going to say September 15th is this person's birthday. They're eligible September 1st. They can use the 3 months prior to take care of the enrollment. That way they don't lack any coverage. Both Part A and B would begin September 1st, okay? Now, let's say this person is retiring at the end of the year. They want to retire in employer coverage. They're turning 65, but they want to wait until January 1 to truly be off work. So here's September, October, November, December. If you enroll in September, your Part B would start in October, November. If you enroll in November, it starts in December. If you enroll in December, your Part B would start January 1. Unless you want to be paying the $174.70 the entire time, up until January, you will want to complete your Part B enrollment in December. Okay, you can't go in and sign up in September and tell them January 1, okay? So just making sure that you are aware of that. In this case, if somebody were retiring here at the end of a year and they had the September birthday, my advice would be that they use the first 3 months before their birthday month and pick up Part A only, and then they pick up Part B in December, okay? That way you get your Medicare number, right? Now, enrollment in A and B does occur at the Social Security office. You can go to the office, you can call and make a phone appointment, or you can go online. If you need instructions to do the online, we're happy to email those to you, okay? If you want to make a phone appointment, just know that they're about 40 days out typically on appointments, okay? So if your birthday is in May, you turn 65 this year, a phone appointment would not work if you need to move to Medicare that soon, all right? So this is your initial enrollment period. Now I want to talk about the person who says, hey, I want to continue to work. I'm going to work until I'm 67. And so now I want to stay on my employer plan. I've decided that's better for me. I've spoken with somebody, confirmed, I'm good to go to stay on the employer plan. You have a new window called a special enrollment period. That enrollment window will open 3 months before the date you want your Part B to start. Keep in mind, Part B can only begin on the first day of a month. You also need to confirm with your employer if your last day of work is the 24th of the month, will your health insurance end on the 24th, or will your health insurance end on the last day of the month? Because Part B can only begin the first day of the month. Now you can overlap A and B with your employer coverage, and you could start that then at the beginning of the month that you plan to retire. But additional coverage that you would pick up cannot overlap even one day with your employer plan. So it's very important to map out your timeline in this case. Now you do have 2 months after the last day you have employer coverage to get enrolled in certain plans and avoid the penalties, okay? You technically have 8 months still to pick up Part B, but if you don't get qualifying drug coverage within 63 days, that's when the Part D penalty would kick in. So I typically tell people if they are retiring over 65, make sure you do something in the 3 months prior to the first of the month you want coverage, or at least within 2 months after that, okay? I'm going to give you a timeline example here. In this example, this person knows they want to start Medicare on June 1st. Their window to start that process will open on March 1st, so always 3 months before. What you do need to know as well is there are additional forms that have to be completed by your employer and by you in order for you to pick up Part B. They have to have the employer complete what's called an L564. It's an employer verification form. And the employer will be marking what day you started coverage, when you were employed by the company, so that Social Security knows you have had health insurance that was qualifying since at least age 65. If you've had health plans through 2 different employers during that time, you have to get a form from each of them, okay? Keep in mind, this is a specific form. You can't just take a letter on your company letterhead saying that you're losing coverage, okay? You will also yourself fill out a Part B enrollment form. If you've picked up Part A, you'll have a Medicare number. If you have not, then that process is just a little bit different, okay? But regardless, you need the employer form, okay? Now, you might be wondering why somebody would be 67 and retiring but not have picked up Part A for 0 premium at age 65. And the reason for that is because health savings accounts do not work with Part A Medicare. If you have Part A Medicare, you need to stop contributions into a health savings account plan. Now, You could still be on the health savings account insurance, so on the qualified insurance plan, okay? But any contributions that you make to an HSA, you will end up having to pay tax on them. And if you continue to make the contributions for a full 12-month period, you will pay a 6% penalty on any dollars contributed, okay? Now, at 65, if you have not elected to take Social Security, you do not have to pick up Part A. You do not have to call Social Security and say, I don't want to take my Medicare. There is nothing you will have to do as long as you have qualified employer coverage, okay? So keep that in mind. Now, if you have started Social Security, then you will have to take Part A. You cannot decline it. So it's very important to understand how health savings accounts could affect your Medicare. Also, because if you are retiring, say at 67, and you start the process to enroll and pick up your Medicare, when you go to enroll, they do backdate your Part A 6 months. There is no way around that. It is an automatic clause that happens, okay? So Social Security demands it. So that could affect how much you're contributing to the HSA, right? So keep in mind, if you're on a health savings account plan through your employer, you need to know some things ahead of your retirement so you can do some planning, okay? So just keep that in mind here. All right, I want to focus now. I don't see any questions. I keep checking, and again, don't be shy. But let's talk about your options. So you've already decided you're moving to Medicare. You've picked up your A and B benefits, or you know you're going to be starting those. Let's talk about what options you have to make sure you have full coverage, okay? So your first option is to do a Medicare supplement with a Part D plan, okay? Or your second option is to consider a Medicare Advantage plan, which would be Part C, right? So no matter what you do, you have to have A and B. It's just how you're covered beyond that. Now, the first part of option one is the Medicare supplement, also known as Medigap. They like to give two names to everything in this industry. You will choose a health plan, okay, and pair it with a drug plan. Typically, plans G, N, and high deductible G will give you the best value currently, okay? Once your Part B date is set, you can enroll in those 3 months prior after you pick up Part B. You also have a guaranteed option to pick up any supplement for 6 months after your Part B date, okay? Now, what you do need to know is you have no annual option to change a Medicare supplement. You can change your plan every month, but you would have to answer medical questions to make a change. So there is no guaranteed annual enrollment period for supplement plans. So I want to make sure that you understand that period of time in the fall does not apply to supplemental coverage. Typically, once people choose a plan, they rarely change that supplement. Now, I want to go over a few differences here real quick on G, N, and high deductible G. So G is currently the most predictable option that you'll look at. It used to be F because F covers 100% of what original Medicare does not pay for, okay? So that hospital deductible of $1,362 or your 408 copay for the next 30 days or $816 copay for the following 60 days. So everything would be covered under Plan F, but in 2020, Plan F went away for anyone turning 65. So if you were born 1955 and later, you cannot get Plan F. So Plan G is really the plan. If you want the most robust benefits, you're going to look at G. It covers everything but the Part B deductible amount. Okay, so if you look here, that's the only one that has the red X. That's what you would have to pay out of your pocket, is the $240 deductible. N is very similar. It still covers everything if you go to the hospital, but you still have to pay that Part B deductible. You could potentially pay excess charges if you ever see a doctor that doesn't contract to take Medicare, but that doctor is seeing you for something Medicare covers, okay? And then these little asterisks here under Part B, okay, so Plan N also covers the 20% not covered under Part B by original Medicare, okay, just the same as G, but you would have some copays. You would pay $20 for certain doctor visits and $50 if you go to the emergency room and you're not admitted, okay? So G and N are two very predictable plans. We don't have very many carriers covering K, L, and M. And for the premium they charge, for example, on M, you're better off taking Plan N. And then the only other plan we occasionally see is G high deductible, where you would have to pay the first $2,800 towards the cost under Part A and B, and then the high deductible G would pick up 100% of the cost, okay? So they refer to that as a high deductible G. So you have all this alphabet soup, as I like to call it, available to you. They're all standardized. There are hundreds of carriers that offer Plan G or Plan N. They're all going to set their own premium rate, but they have to give you the same health benefits. Some of them could have extra perks like a gym membership or if you have some vision, that type of thing. But the health benefits are the same. Okay. Now, along with that, you will see then that you should choose a drug plan, and it would be a standalone drug plan that you would choose. What we do here is we take your list of medications, we enter them into the Medicare.gov plan finder. You have to put in your zip code, what pharmacy you use, and it will help us evaluate out of the plans available to you in your county of residence, which plan will save you the most money overall. So between premium and the cost of your medications, how can we make sure you're not spending more than you need to be? Okay. So the Medicare.gov planner is a pretty slick tool. It's not the most intuitive. For those of us who use it regularly, it's a little easier. But that's something we specifically do for the people we work with. Each year you may change your drug plan. I shouldn't say you must. They will send you an annual notice of change. You can look over the benefits and say, oh, yes, it looks like my plan is great. And you don't have to sign up for a new plan. You can stay in it. But if you should switch to a new plan, you would need to do that in the fall, and the new plan would begin January 1. Okay? All right. And then, again, I'm going to remind you, read your annual notice of change. If you move to Medicare, that's a very important document in the fall that you will receive. Okay? Now we're going to look here at what your potential premiums could be right now. So option 1 examples, what you need to know is they are very specified for premiums for male or female. Okay, so your premiums will be different. If you're a smoker or a non-smoker, if you're 65 or 75, you're going to be looking at different premiums. Okay, so these plans do have different premiums based on age. They do look at zip codes and access to hospitals, that type of thing. For the most parts, most states may have the same premium for each carrier or divided into, say, northern and southern regions, that type of thing. But this should give you an idea on the left-hand side. If you wanted the most predictable coverage and you said, I want G, I have the least amount out of pocket, this is what I would roughly be paying, okay? On the right-hand side is a high deductible G, so you can see it's a lower premium, but you would pay the first $2,800 towards your care. And then that high deductible G plan would pick up the rest. A plan N runs somewhere around $30 less than G, and remember that plan has some copays, okay? What you do also need to know about option 1 is there are no networks. You can see any doctor that takes Medicare, okay? Now with the drug plan, you'll have preferred pharmacies, But the health plan, you can see any doctor anywhere that Medicare is taken. So you don't ever have to worry about a net. Okay? People typically consider them very predictable, flexible. They're going to give you the most robust coverage. Okay? So this is option 1. Let's move on to option 2, which is Medicare Advantage. You need to know that every year your plan will renew automatically unless for some reason the carrier is eliminating the plan, okay? If you're happy with your plan, you don't need to do anything year to year. But it is important to understand the components that change and pay attention to your annual notice of change. Now keep in mind, Medicare Advantage plans replace the schedule under original Medicare. So all those figures we looked at on the page that had A and B, those are replaced by the private insurance company that will be paying for your benefits instead of original Medicare, okay? You still have to be enrolled in A and B. You have to pay the $174.70. Now, they have to cover at minimum, say in network, 80% of the cost for things like doctors and outpatient services. So it's important to know they have to cover the same as original Medicare in that sense. They just don't have to cover your 20%. They do have to have an out-of-pocket maximum. They'll have a network of doctors that you can see in order to save the most out of your pocket. Now, it's important to know that the networks might be on a preferred provider organization, PPO model, or a health maintenance organization, HMO model. If you choose an HMO, you need to get all your benefits in the network. If you go outside of the network and it's not an emergency, you will have to pay 100% of that bill. So the key with these is if you decide this philosophy works for you, you would want to make sure your doctors are in network before choosing a plan. Also make sure your medicines are covered the way that you want them to be. Some plans cover certain high cost brand name medicines better than others, okay? Now, what people love about Advantage plans is they all have gym memberships. Right now, most have dental and vision on them. You might even get over-the-counter dollars that you can spend at a pharmacy on things that are not prescriptions. So vitamins, Band-Aids, cough syrup, that type of thing, okay? So keep in mind, Medicare Advantage, that's your second option. You would take an Advantage plan, and most of them incorporate Part D. The plans that do not are typically just for people who have veterans benefits, okay? So if you're A and B that you have to be enrolled in, but then instead of working on the A and B schedule, the Advantage plan will set a schedule for you, okay? Now looking to give you an idea, on the Advantage plans, what you need to know is the prices are the same for male and female, no matter what your age is. If you're a tobacco user or not a tobacco user, you pay the same depending on what county you live in. You have to enroll in a plan available in the county you reside in, and it will be your address according to Social Security, okay? So you'll see here, you still have the Part B premium. The Advantage plan premiums, they're very low, but you're going to have more potential out-of-pocket costs. So this is really just, what's your philosophy? Would you rather pay lower premium and higher out-of-pocket costs as you need care? Or are you someone that you prefer paying a little more premium to have more predictability and flexibility and pay less out of your pocket when you need care? Okay, there is no wrong answer. It's just a matter of how do you prefer to be covered. It is also very important to understand what can you or can you not change during the annual enrollment period. The way it gets portrayed, most people believe you can change whatever you want year in and year out, okay? But that is not true. So keep in mind, Medicare Advantage plans, you can enroll in a Medicare Advantage plan every year during annual enrollment period if you've never been in a plan. You can change from one Advantage plan to another every year during the AEP season. And you may leave a supplement with the drug plan and move to an Advantage plan in the annual enrollment period. Okay? So pretty easy to pick up Medicare Advantage plans, but it's all about the time of year. Okay? Prescription drug plans, very similar. You can enroll in a drug plan each year if you've never been in a plan. You can enroll in a drug plan and leave an Advantage plan if you wanted to, okay? Take your A and B original Medicare back and work on that schedule. And if you're in a drug plan, you could change to a new drug plan during the annual enrollment period, okay? Now, Medicare supplement, Medigap plans do not have an annual enrollment period, okay? If you want to switch from one supplement to another, you have to answer medical questions to make that change. You could be denied, or a few carriers may say, we'll take you, but we're going to charge you a higher premium, okay? You do have 6 months from the time your Part B starts to still get into a Medicare supplement, okay? As I mentioned before, you might want to use your 3 months before your Part B date, but you do still have 6 months after. You also do have a 12-month period that you can try a Medicare Advantage plan. And if you are not happy in the Advantage plan, you can go back to a supplement, okay? Now, if you chose an Advantage plan first and you were never in a supplement, you're going to be very limited on the supplement you can get into. If you were in a supplement and moved to an Advantage plan, you have to go back to the supplement you had unless you're healthy enough to qualify for the medical review, okay? So keep that in mind. Now, it looks like I have a question. So I'm going to address this before I go on to the last part of the presentation. So it says here, I turned 65 this month. I'm already enrolled in Part A, and I plan to drop employer coverage at the end of 2024. To enroll in Parts B and D in a Medicare supplement, I won't be retiring completely and won't be forced to drop employer coverage. It's my choice. Does that scenario still avoid the penalties for Part B and D? Yes. Now, the next couple of slides will tell you quite a bit as well, but you will avoid the Part B penalty and you will avoid the Part D penalty. The size of your employer can play a role whether or not you should maybe go ahead and move to Medicare, and we're going to touch on that next, but definitely your penalties will be avoided because you've stayed on an employer plan and you've had employer coverage since the time you turned 65, okay? So I think I've clarified that. I thought that was a good time to stop and answer that question, but definitely you would avoid the B and D penalty as long as you are on employer coverage. Now, thinking about employer coverage here, okay, who pays first? So let's say you have Part A and you have an employer plan as well, and you're 65 or older. If the employer has 20 or more employees and you get admitted to the hospital, the group plan will still be paying first, okay? So all your claims will still go through the group plan first. Your Medicare Part A would be a secondary payer and start paying once you've met deductibles under your group plan. Now, at the end of the day, it can help you a little bit before you get to your maximum out of pocket, but it's going to help maybe the insurance company more than you, okay? Now, if your employer has fewer than 20 employees, then Medicare pays first. So in this scenario, if you were 65, you're still planning to work, if you have fewer than 20 employees, you need to pick up Part A and B, because otherwise your group health plan will require you to pay the 80% for Part B benefits, okay? So you would need to, if you are working over 65 and you have fewer than 20 employees, definitely confirm that you're not part of a larger trust agreement or something like that for your group association. But know that Medicare would pay first, and you may need to go ahead and pick up A and B. If you're not covering a spouse with your plan, then you may want to go ahead and just move to Medicare, even though you don't plan to retire. Oftentimes it ends up being a lower cost option for you, okay? So keep in mind who pays first, depending whether it's more or less than 20 employees. The next scenario is really if you are Medicare eligible due to disability, and so you are under 65 with Medicare, the employee number they use is 100. So if there are more than 100 employees, then the group health plan pays first. If there are fewer than 100 employees, then Medicare pays first. So I run into this scenario a lot, not necessarily for the employee themselves, but for a spouse. So a spouse may become eligible for Medicare due to a disability, but if the employer doesn't have 100 employees, it could just make sense for that spouse to go ahead and take Medicare entirely. Okay? All right. We're moving right along here. I think we'll be done on time. I like to make sure people know about their resources, okay? If you are ready to sign up for Medicare A and B, you're going to do that through the Social Security office, okay? It doesn't happen through the Medicare.gov or Medicare. It happens through Social Security, okay? You can go right online and sign up. If you're over 65, you're still employed, that's when that L564 employer form is needed. We have instructions written out if anyone needs those on how to upload a form, that type of thing. If you decide you're applying for Social Security, you can take your retirement check, the Social Security check, that they will automatically enroll you in A. If you are taking Social Security before age 65, you will be passively enrolled in A and B and receive your Medicare card 3 months before your 65th birthday, okay? But you can go online and check all of that out on Social Security. I would encourage you to set up a socialsecurity.gov account if you have not done so already, okay? They really encourage everyone to do the online process. Medicare.gov does have a lot of good resources out there. This is, again, where we go and we'll look at drug plans or advantage plans. Anyone has access to that tool. Again, it's not the most intuitive, but I want to make sure you know Medicare.gov, SSA.gov, very good information out there, okay? Of course, at Henriot, we are happy to be your resource. So if you need help, don't hesitate to reach out to us, okay? Happy to help you. We also have Lorraine Lewis, who has recently joined our team. She will eventually be doing a lot of meetings out of our Indianapolis office. So still working with her to get her trained and ready to meet with people. But we're here to help you. We're here to be a resource, answer questions, help you build your timeline, know where you need to go for resources, how to get the information that applies to your situation, okay? Now it looks like I have another question. This is my last slide here. I'm gonna answer this question. And then if anyone else has anything that they need, actually I'm gonna address the most recent question here first. So can you get a copy of the presentation via email? Yes, you can. If you could please email us at the medicare@henriot.com, send an email to us, and we will send you the presentation, okay? So send that email to medicare@henriot.com. We will send you a PDF version of that. Now, the other question I have here is just clarifying, do I need a letter from my employer stating when my coverage ends to take with me to the Social Security office to initially sign up? No. So if you're turning 65, You don't need anything from your employer. If you are over 65, you don't need the letter from your employer. You need a specified Social Security form called the L564. We are happy to email that to you. If you want to email us at themedicare@henriot.com, I can send you that form. They do not take the letter from your employer. They only take this employer verification form that is a specified Social Security form. It's a good question. Okay. Actually, on that form, since I have another minute here, you never actually put your last day of insurance with the company. You'll put that your employer will fill it out and say that you're still employed. You will have to let Social Security know when you intend to start Part B. And so as long as that shows you have still been employed within the last 8 months, they'll honor your Part B date, but they never backdate Part B. Okay, only Part A. Okay. Been happy to help you build any timeline, understand specifics according to your situation. I know we cover this from a pretty high level here, and so sometimes that can be rather confusing. All right, looks like I have another question that came in. So yes, get a link to view the presentation with audio and video. Yes, so we will have that ready. It usually takes us about 24 hours for the presentation to be ready to send out with the audio and the video and everything. So again, if you don't mind emailing, feel free to go ahead and email for that. I do believe the last webinar I did is recorded out on our hgisolutions.com webpage. You can find it there. Or we have what's called a Henriot YouTube page, and you can find the 2024 Medicare 101 presentation that I did in January. It's recorded out there and posted. So, but if you want the new link to today, it's same material actually. But if you want specifically today's presentation, just send us an email, and usually that's about 24 hours. We have our marketing person clean it up a little on the front and back. Okay, thank you so much to everyone. We really appreciate your attendance, and don't hesitate to use this as a resource. We're here to help you. This is a confusing topic, and no one needs the undue stress over it. We want you to have a happy retirement. Okay? All right, looks like it's 12:54. I'll hold on just one more minute if anybody needs help or has more questions, and otherwise, don't hesitate to reach out. Happy to be of assistance to you.